What causes ADHD symptoms? This is the question I ask all my students at the beginning of every semester. I get some fantastic answers. By far, the most popular answer is that obviously ADHD is caused by a neurological issue, either an imbalance of chemicals such as dopamine or norepinephrine, or that there are areas of the brain that are smaller in kids with ADHD as compared to their normative counterparts. Is this true? Where do my students get this information from? If we take a look at some of the headlines that we've seen over the years, maybe we'll get an inkling of an idea. So let's look at two headlines from 2017. Headline number 1. Study links ADHD to 5 brain areas. Brain regions involved in emotion and attention are smaller in children with ADHD. Headline number 2. ADHD is a brain disorder, not a label for poor parenting, say scientists. So ADHD is a brain disorder. But there's something off about this story, and I would like to invite you to take a journey with me and try to figure out if we are indeed being told the truth about the origin of ADHD. Because we parents need to really understand what is going on for our child and really dig deep into a diagnosis that our child is getting. Let's start with Dr. Google. The first site that pops up when I put in the search bar causes of ADHD symptoms is the CDC, a government body. Quote, scientists are studying causes and risk factors in an effort to find better ways to manage and reduce the chances of a person having ADHD. The causes and risk factors for ADHD are unknown. Source number 2 is the NIH, which is another government organization. Scientists are not sure what causes ADHD, although many studies suggest that genes play a large role. Source number 3, WebMD. The cause of ADHD isn't known. Researchers say several things may lead to it. Why are these websites not letting us know about the brain chemical imbalance? Let's dig a little deeper and find out what leading psychiatrists have to say about the brain chemical imbalance causing ADHD symptoms. Few doctors have had the confidence to question the diagnosis and drugging of so many American children. Dr. Fred Bauman has been a brave voice seeking to sound the alarm on this practice. In 1998, he wrote a letter to then Attorney General Janet Reno. Quote, the single biggest healthcare fraud in U.S. history, the representation of ADHD to be an actual disease, and the drugging of millions of entirely normal American children as treatment is spreading like a plague. That ADHD is wholly devoid of validity as a disease, a medical syndrome, or anything biological or organic is the pivotal element of the fraud. End quote. What is Dr. Bauman saying? He's saying that we cannot find any biological cause of ADHD symptoms. And the fact that medicine is representing ADHD as a biological disorder is the biggest fraud in American history. Let's keep going. In 2008, Dr. Sharma, who is the Director General of Health Canada, had this to say, quote, for mental psychiatric disorders in general, including depression, anxiety, schizophrenia, and ADHD, there are no confirmatory gross microscopic or other chemical abnormalities that have been validated for objective physical diagnosis. End quote. What is Dr. Sharma saying? We haven't found it. We don't see it. There is no indication that ADHD is a neurological disorder. Now this one is the kicker. Dr. Ronald Pies is one of the most respected voices in psychiatry today. Not only is he professor of psychiatry of 2 major universities, but he's also the editor-in-chief of the authoritative Psychiatric Times. When this guy says something, we all listen. What does he have to say about ADHD and the brain chemical imbalance notion? Quote, in truth, the chemical imbalance notion was always a kind of urban legend, never a theory seriously propounded by well-informed psychiatrists. What? What is Dr. Pai saying? He's saying that we psychiatrists in the know have never claimed that ADHD was a chemical imbalance. Only the psychiatrists who are less educated are the ones spreading this urban legend. Aha. So every psychiatrist I have met, and probably most that you have met, are uninformed, are uneducated, and are therefore spreading a mistruth about the origins of ADHD. Where are we to go with this? Is it neurological? Is it not neurological? Studies have been done since the late 70s to find the chemical cause of ADHD symptoms. We are now deep into the 2000s, and so far we have found nothing. Don't lose hope. 2017 major study published in the Lancet. And what does this study say? Quote, we confirm with high-powered analysis that patients with ADHD have altered brains. Therefore, ADHD is a disorder of the brain. This message is clear for clinicians to convey to parents and patients, which can help to reduce the stigma of ADHD and improve understanding of the disorder. End quote. The Lancet study is letting doctors know that they should please pass on to parents and patients the knowledge that their ADHD symptoms is clearly neurological. What are we to do with this information? There's a lot of criticism of this study. Let's go through a couple of points. Number one, what was not reported was that kids with ADHD symptoms actually have higher IQs than children without ADHD symptoms. Wouldn't that have been an interesting headline? Number two, we have no idea what the medical history is of any of these children. Could medication taken over a long period of time possibly be causing some of the abnormalities in their brain? Number three, this enormous study only found that 5% of kids with ADHD symptoms had abnormalities in their brain, which means if you have 100 children with ADHD symptoms, only 5 of them would have any sort of detectable, yet not quite understandable differences in their brain. When Dr. Hugman, who ran this study, was confronted with these problems, this was her response. Quote, the criticism of a small effect size raised by these letters imply that we should only use the term brain disorder when everyone with a disorder shows the same pattern of brain abnormalities. By that definition, no psychiatric disorder would be a brain disorder. Wow! Dr. Hugman just made order of everything. In every other area of medicine, if one wants to describe a disorder, all the people that have that disorder would be presenting similarly. With the only area of medicine that this is not required is psychiatry. When an enormous study where thousands of children are involved, and they only find that 5% of those children show any sort of abnormality, and that there are children in the comparison group that also show this abnormality, we can still call it a disorder. So what Dr. Hugman is saying is that ADHD has not been found to be a neurological disorder. What are we to understand from this? Your child, as well as mine, is healthy. That's the good news. What else? We're asking the wrong question. We keep trying to find out what is wrong with your child's brain so that we can tinker with it and fix it with all sorts of chemicals. What we should be asking is, why is your child and mine struggling? Find a solution to his or her suffering. If we can take a journey of curiosity, then we will be able to find the root causes of our child's struggles. And what we'll be surprised to see is that the least likely cause of ADHD symptoms is going to be an abnormal or unhealthy brain. So let's link arms, open ourselves wide with curiosity, and say, why is my child not flourishing? And then we will be able to find the answers and help our healthy child do great. If you enjoyed this video, please like and subscribe and share with friends. And of course, let me know your thoughts. All of the information in this video can be found in my upcoming book, Hyper Healing, Show Me the Science.